So we want to welcome you guys today to another episode of Moving Mountains with me, Sumayyah Simone, and Sheila Ely. And we have a special guest with us today, Dr. Uchenna Onyeani.
Hi.
And let us tell you, we want you to appreciate who we have with us today. Dr. Uchenna Onyeani received a Bachelor of Arts degree in biology from Rutgers University, Newark, and later went on to pursue his Doctor of Chiropractic degree from the New York Chiropractic College in Seneca Falls, New York. Dr. Onyeani, lovingly known to many as Dr. O, is a board-certified chiropractor licensed by the National Board of Chiropractic Examiners and is a member of the Association of New Jersey Chiropractors. He has more than a decade of professional accomplishments in chiropractic healthcare. Dr. O shares his breadth of knowledge and depth of experience and holistic solutions with clients, friends, and family on an ongoing basis, and he is here to share that with us today. Thank you so much, Dr. O.
Thank you for having me.
Welcome. We are very honored to have you with us today.
Yes, we are.
Good to be here. Thank you for having me on such difficult times that we're in right now. I really appreciate the invite.
Yes. Anytime, actually.
Thank you. Thank you.
So, we've been talking about, what's going on with this current outbreak of coronavirus.
Mm-hmm.
And it's really troubling because you see in the news that in some places, 70% of the people who are dying are Black.
Mm-hmm.
And I mean, we know that there's disparities in healthcare already. We know that, we top all the worst lists,
Correct.
So, what do we do about this? Sheila and I have been doing a lot of talking, and we've been talking with you as well about the fact that, we have to take our healthcare and responsibility for our healthcare back.
Yes.
We have to take charge of our own care. We have to take charge of our own health.
Correct. That starts with research, right? That starts with wanting to take the time to know your body. I think one of the issues, and this is across the board, not just with African Americans. I talk to my patients all the time, and I explain to them that doctors are not God. They don't know everything, and they are liable to make a mistake from time to time. And so it's very important that you as the patient, you as a person, knows your body, knows what you can or cannot accept, because that could be a matter of life or death. And so when we talk about African Americans in particular, we have a healthcare system that is biased. A lot of people don't want to admit or they deny the fact that there's any sort of discrepancy, but it's there. And one of the problems that we see is that the African American body is different. There are things that are different compared to other groups, and not enough, at least in my opinion, not enough is being done to understand these differences and understand, based on those differences, how do you then provide treatment? What is the protocol for treatment for certain ailments, And so my concern is, particularly now we're talking about everything with the coronavirus and the current treatment protocol that they have in place. There are certain concerns that have been raised based on this discrepancy. And so one of the things that I'm worried about, something known as G6PD deficiency. It affects over 400 million African Americans. We're talking about Italians are being affected by this. I mean, there are many people, Jewish people of Jewish heritage, who are being affected by this particular deficiency. And one of the concerns that I have right now is the current protocol for treatment for the COVID-19, as far as the little kit that they have, the kit to help the curing process, if you will. It can exacerbate symptoms in those with this particular deficiency, as glucose 6 PD deficiency that we're talking about. And so, these are some of the things when we talk about knowing your body and doing the research to know what is going on. These are some of the things that we're talking about. And this is, a test that you can do at the doctor's office, and we can get the results. So I think that's something that, regardless of whether there's a COVID, quarantine, outbreak, pandemic, this is something we should be doing regardless, with our physical and our yearly physicals, that is, and determining what is going on in my body and what can I do to make sure I'm at my best health.
Right.
I agree, because I have G6PD deficiency, and not knowing enough about it, I was doing an IV vitamin C protocol for cancer, and it almost killed me.
Wow.
So when we're talking about the protocol that they want to do for COVID right now, well, everything on that protocol goes against anyone with that deficiency. The hydroxychloroquine, the high doses of the IV vitamin C, the zithromycin, because there are lists of medications that aggravates this condition and can cause you to bleed out those red blood cells. So many of us are here, we don't know because no one tests us. And the thing about Western medicine, the bias, you go into a doctor's office, they spend about 5 minutes with you. They don't get to know you. They don't know enough about your body. And if you tell them that, well, I looked at this, and this, seems to me that I may have some of these symptoms, they'll say, well, if you got that off of the internet, that's not really medicine. But that's why I'm here, for you to find out. And I'm gonna give you a good example. So when I had my genetic testing years ago, it was right in there. But yet the geneticist was looking for one thing in particular for me. And that's the only thing he told me I had. It wasn't until I was looking for what else was wrong that I found that. And it was right there. So we have to ask more questions. We have to be actively involved in our own health choices.
Correct.
And we need to keep those choices. And if someone is not willing to take the time with you, then you need to find another practitioner. But in the meantime, we are so different until it is very crucial that we ask for tests that are relatable to us. And if you've got 400 million people of African heritage with this condition, I would think that this is a test that actually every one of us should have.
Should be mandatory. I mean, to be honest with you, you're absolutely right. I mean, and you talk about people of African or African American descent. I mean, that's most of the world. If you really want to be honest with yourself, everybody has a little Black in them. Some people don't want to admit it, but this is something that doesn't just affect people with brown skin. We're talking about people who might have gone through generations where they don't necessarily look like you and I anymore, but they still have that genome and need to be tested to make sure they are preparing themselves in case they do have something like this, where there's a pandemic or where there's a protocol that could potentially kill them if they don't know their genetic makeup and the potential harms to the genetic makeup. So I agree 100% with you that this is a test that we should be doing for everybody.
Well, it's just a simple blood test, and insurance pays for it. In New Orleans has a huge problem down there with so many deaths, especially Blacks, with G6PD. But I was talking to a good friend of mine, and she said there are a lot of Italians and Mediterraneans, because New Orleans is a hodgepodge: French, Mediterranean, Italians, Blacks, Haitians. We've got it all down there. And she said they haven't asked what type of whites are dying from this condition. And she's down there, and she said, I can tell you they are of Italian, Mediterranean heritage. Those are the ones.
Interesting.
But no one's asking those questions, and they're just assuming. I heard something so disturbing today from the Surgeon General. He came on it and he said that Blacks must give up the alcohol, the tobacco, none of which I've ever done.
Mm-mm.
Um,
Yeah.
and the myth about you can't catch coronavirus. And I'm thinking to myself, you're the Surgeon General of this country.
Mhm.
You're a black like me, and
Mm.
these are your words?
And the thing is, and he's unfortunately a victim of the education system and the medical system. They don't teach us this, right? This is
Right.
something you have to find out on your own. So he's a product of what has been taught to him.
Mhm.
Right.
And so what has been taught to him is African Americans are usually high blood pressure, high sugar because they have a poor diet. They drink a lot. They eat a lot of oily foods, and they don't take good care of themselves. And that's not the reason
Right.
entirely for what's going on. There are other people who have diets that are just as bad, if not worse.
That's
Uh,
right.
and so it's important that we don't start generalizing or making blanket statements like that. And I think it's important that doctors, researchers, scientists look into this and see if perhaps this might be one of the reasons why we're seeing this rapid rate in death among African Americans and those of African descent. So I definitely I hope that they do look into this, because it's a very important factor to consider.
Well, I
Right.
can say this about it. I know black vegans
Hmm.
who they have the cleanest, the best diet. But the problem is, if you have G6PD deficiency, they only tell you fava beans. No, you shouldn't eat any legumes. And what's the protein that's most prevalent if you're a vegan? Legumes.
Yeah.
And there you are, you're constantly breaking the body down with them because there's something you shouldn't be eating. You shouldn't have soy in your diet. There are different types of medication you shouldn't take. I mean, this is such an educational process, but the first step is to know your body. And we don't know our bodies because no one has told us that these are possible things. You type a baby for sickle cell anemia because that's so prevalent. Well, this is just as prevalent, but no one types that baby and no one types that adult. And we need to change the way we do it so health can improve, because everyone doesn't have a bad diet. But what does that have to do with this virus?
Right.
Whether or not you have a good or a bad diet, you're catching the measles.
Right.
You know,
Right.
I caught the measles, we all did, and developed herd immunity to it. So they're just conditions that you will catch. You might catch the flu if the body is tired and the immune system's not working properly.
Right.
And you're just gonna throw a blanket statement out like that, and you can't.
Yeah.
We have to ask that we are tested and our children are tested, because this is unlike sickle cell anemia where both parents have to carry the trait to pass on the full-blown gene. A father could have G6PD deficiency and pass it on to the baby. A mother can pass on one SNP panel or more of G6PD deficiency. You may not see it until later in life, but if you're eating peanuts, for example, that's a no to this condition.
Mm-hmm.
So we need to we need to compel our people to go out and ask these questions and get these tests, and not just for this coronavirus, but just for our general health in public, in our general health.
I agree.
I
I
agree. I agree. And I think we need to really look at the fact that the medical system, not just the frontline doctors, nurses, people that we see, but the researchers and the scientists are biased.
Yes.
Biased even in their questions that they ask and attempt and how they attempt to answer those questions.
Mhm.
So we end up getting left out in the cold every time. And so we have to start taking that and saying, you know what, maybe we should be doing the research on us,
Correct. Correct.
right?
I agree.
Well, Sumayyah, you and I have had many conversations about that.
Yes, we
How
have.
do we find scientists to be willing to partner with us and
Mhm.
at least pull down some statistical data so
Right,
that we can see what's going on completely in our community other than what we're hearing?
right,
Well,
And the
hopefully we have a few of them watching today who
right,
will consider, taking this project on.
right. Absolutely. So, Dr. O, um, back to the subject of COVID,
Mhm.
COVID-19 or SARS-2.
Yeah.
What is it?
It's a great question. You know, I'll tell you, I am somebody who's very visual. So I put together a little bit of a slideshow just to kind of give people a better understanding of what's going on. I'm sure by now everyone's been watching the press conferences and has a pretty good idea. So for a lot of people, this is probably just review. But you know, there are some people who have been avoiding the news and have been avoiding these press conferences, and so I still think it's important to be informed on what's going on. So if you allow me a couple of, about a minute or two, I just want to pull up a little slideshow here, just to give everyone a little bit of an understanding as far as what's going on here.
Right.
I'm just going to pull this up here. Let's see. All right, and can everybody see me okay?
Yes.
Yes.
Wonderful, wonderful. Okay, so COVID-19. One of the concerns that we have when it comes to COVID-19 is the fact that when you look at other common conditions, the common cold, flu, allergies, you know, a lot of them have one or two symptoms that can be detrimental. We're talking about fever, we're talking about a dry cough, shortness of breath. But with the COVID-19, all three are present. And so that's what makes this virus a little more dangerous than the other common conditions that we're used to seeing. Again, we're still learning this virus. So what we're seeing today on this Friday, April 10th, it's not something that is necessarily etched in stone. This could change, you know, in the next several weeks. But as far as what we know today, you know, COVID-19 presents a huge problem because of the fact that it is something that produces fever, dry cough, and shortness of breath. Now, I want to kind of hone in. We're going to get to the fever in a little bit because the fever is really the body's response, if you will, to the entrance of an outside antigen. But we're gonna talk about that in a few minutes. But what I'd like to do first, I'd like to discuss the dry cough and the shortness of breath, because that's really what has been the key factor when we talk about the severity of this particular virus and those who have succumbed to this virus. It's usually, according to reports right now, it's usually because of something related to respiratory, acute respiratory disease or respiratory issues from the COVID itself. So let's take a look at the respiratory system just for a couple of minutes here. So as we all know, two lungs, and maybe even we don't know, we're learning today. So we have the two lungs, and you know, there's a difference between ventilation and respiration, right? Ventilation is inhaling and exhaling, that's ventilation. Respiration occurs, and if you follow the mouse here, respiration occurs down in this area over here. We're talking about the alveoli, we're talking about the capillaries here, and this is where you see the exchange of oxygen and carbon dioxide. This is what we call respiration. There's also the nutrients that are also being put into the blood so that the blood is now oxygenated and then can go through the rest of the body. Along with the lungs as part of the respiratory system, you also have your trachea here, and then you have your nasal cavity along with the oral cavity. So one of the big things that we're seeing right now, they're talking about wearing the mask and wearing the gloves. And now, why is that such a big deal? According to reports, as far as how COVID affects the body, the way it usually enters the body is either through the nose or through the mouth, and then attaches itself to the mucus lining that goes all the way down into the lungs. When the virus attaches to that mucus lining, it then uses those cells to replicate. And then the body then sees this and tries to fight it. But we're going to get into that in a little bit as far as the body's immune response and what that means and what that could result in. If we look at this as far as the respiratory system is concerned, one of the key things that comes to my mind is if we're going to beat this virus, we have to make sure our respiratory system is at optimum capacity. We have to make sure that it's in good shape. And so there's certain things when it comes to our respiratory system. One of the things when we talk about the lung capacity, is breathing exercises. It's a great way to not only get the respiratory system in shape, but to keep it in shape. And breathing exercises are great because it helps to improve lung function, and it also helps relieve stress. Now, stress is a really big thing. The reason why stress is so big is because stress, I call it the silent killer. When we talk about stress, stress leads to a lot of degradation in the body. It leads to a lot of dysfunction in the body. We have a hormone known as cortisol. And this hormone is usually released when you're going through stress. And when you have stress, I'm sure we've all heard of the fight or flight syndrome that the body goes through. Well, with this fight or flight syndrome, part of what takes place is the release of this hormone known as cortisol. And when this cortisol is released, it can have really negative effects on a lot of our organ systems, including our lungs. So these breathing exercises are a great way to help get rid of that cortisol and allow the body to relax. One of the things that we need to make sure we're doing, along with taking care of the respiratory system, is making sure our immune system is also being taken care of. If we have this stress, it's very, very difficult to maintain an immune system that's working at top speed. So the ability to breathe and relax the breathing and be able to get things back in line is important, not just for the lungs, but it's also important for your immune system as well. So I just have a few breathing exercises, because we say, oh, make sure you breathe, but what does that mean exactly? What kind of breathing exercises are we talking about? One of the exercises that we have here is known as the rib stretch exercise. This particular exercise is key as far as increasing lung capacity. What you do with this particular exercise is you stand up straight, you exhale all of the air from your lungs, and then you want to inhale as slowly as you can to fill your lungs with as much air as possible. And then you hold the air for about 15 seconds and then slowly let it out. I can tell you, when it comes to lung capacity, first thing I think of are swimmers. Swimmers have great lung capacity because they need to be able to hold as much air as possible when they're underwater. And so these are one of the stretches that they do to make sure they keep as much air as possible in the lungs. So this is something that we should all do. Regardless of whether you are infected with COVID or not infected, it's important to do this exercise because it's going to help your overall lung capacity. The next thing is the pursed lip breathing. Now, this is key because of what we were discussing earlier. We were talking about slowing down the breathing rate and trying to calm the body down, de-stress the body. De-stressing is very key. And so in order to do this particular exercise, you want to make sure you're relaxing your neck and your shoulder muscles. And you want to make sure that you inhale slowly through your nose. Make sure you keep your mouth closed. You want to inhale through your nose, doing a 2 count. Then, as you're doing that, you want to make sure that you now breathe slowly through your mouth with your lips pursed. And then you do that for a 4 count, and you continue to do this. And what this does is going to help improve ventilation. It also helps to release any air that might be trapped in the lungs. It keeps the airway open, and it helps to slow down the breathing rate. So that's known as the pursed lip breathing. And then the last one that I would suggest is the abdominal breathing. Now, again, with this one, we're trying to get rid of any excess air that's in the lungs. And so the key to this is to lie down on your back, placing one hand on the stomach and one hand on the chest. And I would suggest, as a chiropractor, try to put something under your knee so that you're not putting any pressure on the low back. It's very important to make sure that as you're doing this, you're keeping the spine in as good a shape as possible as well. And with this, you want to breathe in deeply through your nose. And you want to hold that breath for a few seconds and then exhale through your mouth. As you're exhaling, you want to squeeze your stomach muscles. You want to kind of tighten that abdominal core, if you will, and that's going to help get rid of any excess air that's left in the lungs. You want to do this about 10 times before sitting up. Now, one of the things that I will add to this, one of the problems when we lay on our back for too long, it doesn't allow the lungs to function at capacity. So one of the most important things that and I can't stress this enough, sit up. It's very important. I know it's difficult because a lot of people, they're feeling weak. They can't, really do much. And what's the one thing we want to do? We just want to go lay down. We want to lay down because we don't feel like we have much strength to do anything. That's going to be one of the main issues as far as trying to treat this disease. You don't want to lay down too long because by laying down, you're decreasing your lungs' ability to fight whatever's going on. You want to try to sit up as much as possible because that allows the lungs to function at a better rate than it would if you're lying down, whether it be on your back or on your stomach. You want to try to sit up. That's very key, as much as you can. And so when we talk about COVID-19 and we talk about why it's so severe, this is part of the issue, right? It's basically going into the respiratory tract, going and making its house essentially inside the mucous membranes of the respiratory tract. And that causes a lot of issues. So as we're sitting up, I would also encourage people, try to cough out that mucus, try to cough it out. It's going to be very important. And try to avoid certain foods that might lead to mucus production, excess of mucus production. Dairy is one of the key things that I think of when we talk about mucus production. Milk, butter, ice cream, cheese. I see, everybody wanting to do the right thing and help our healthcare workers. But I don't know if delivering a pizza is the best idea. I think it's going to be important that our healthcare workers are eating the best foods possible because they are on the front lines, and we want to make sure we give them every advantage. And so it's important that they're eating foods that are not going to help produce more mucus than they already make. So we want to make sure that we're eating healthy and that we're doing the right things, ingesting the right food so that we diminish the chances of this COVID affecting us as much as possible.
Dr. O, I want to, since you said that, I want to ask you this.
Mm-hmm.
My entire family, we are protein intolerant from dairy, so we don't do it. And I was reading an article about the people from the Congo, the Benin, how intolerant they are to dairy. Why is it then that some people believe that if the milk is lactose free, they can have it?
It's a misunderstanding. People assume that lactose free, for whatever reason, means that it's now safe. Lactose free, what that means essentially is that there's an enzyme that is now placed that allows for the digestion of milk. It's not so much that the products that the dairy has is being removed. It's not the case at all. I just think it's about misinformation more than anything else. So if you have lactose-free milk, that doesn't mean it's not dairy. And I think it's a good that you asked that question because a lot of people assume that, I have lactose-free milk, so I'm fine. No, lactose-free does not mean that it's non-dairy. It's still dairy. It's just that now the lactase, which is the enzyme, that's what breaks down the lactose. A lot of people who drink lactose milk lack that enzyme. And so with the lactase present, now they're able to break it down, but it's still a dairy product. So I'm happy.
It still causes major inflammation in the body, especially if you are of African heritage, because I know so many who cannot tolerate it, but yet they still force it.
They do.
There are only a few tribes on the continent that actually are supposed to drink it after the weaning age, right? Like genetically speaking. And I haven't delved that deep into this genetics yet, but I remember reading through some of it and seeing that, like, if your ancestors weren't, I don't know if it's pastor or whatever it was, that you shouldn't be drinking dairy. And then we wonder why when we drink dairy, it creates mucus and we just accept it, right? But
yeah, I think you're absolutely right. I mean, and to be honest with you, I mean, to be drinking cow's milk, I'm not sure how that became a thing in the first place, but, humans are the only ones that drink milk from a different species. And so, I am somebody who, tries to avoid the milk as much as possible. And I think, a lot of us should practice that same thing, particularly right now. Because of everything going on, you want to try to reduce the amount of mucus buildup as much as possible.
Well, my mother told me she grew up on a farm, a plantation actually,
Mhm.
and she said they never drank milk. They had cows, and she said they used it for medicinal purposes, raw milk. She said if they got whooping cough, her mother would milk the mare and just
Mm.
give them a little bit of the mare's milk to get rid of it. And
Mhm.
she said she would do the same thing with the cow, and then you were done with it.
That
They
was
would
it.
throw it out. They wouldn't drink it.
Mhm.
So it's just amazing that so many people, and even within our family and our community, I talk to them all the time. I said, well, if you got an intolerance to something, well, no, that's just to the lactose. So I'm so glad you said that because that is so important. I said, well, I know that my family is intolerant to the whole thing, the protein of it, but someone needs to break down the difference because if you're allergic to something, you're allergic to something. You can't just take a part of it out and think that you can still have it.
Right.
Absolutely. Absolutely.
And what about cheese? Because I know for some people that's where it gets harder, right? Like, because I've never liked milk,
Yeah.
but cheese, you know, but usually this time of the year, once I see something nasty going around, I'll make an announcement. Nobody's happy about it, but I'm like, you know what? You know, if there's something like this going around, you shouldn't be drinking milk when you know it creates mucus. You
I've
shouldn't be
heard that hard
there.
cheese though, if it's aged, is okay, but we don't do the cheese
Yeah, I
either. We
would
just
say
don't
stay
do
away from
any
the
of
cheese.
it.
Yeah, stay away from the cheese.
Yeah, I don't know anything about it. We don't do yogurt. Dairy is dairy as far as I'm concerned. I don't care if it's fermented or what it is. I
Mhm.
just think for us as a people, it's one of those areas we should really look at,
Mhm.
especially those of us that are filled with so much inflammation. Autoimmune diseases bring on a lot of inflammation, and it's just one small piece of it that maybe you can take out just to see what your tolerance is. Do an elimination type diet, starting with dairy, all forms of it.
Exactly. And this goes back to what we were saying earlier about just knowing your body and understanding what you can and cannot take. I think
Right.
that's a great idea.
And that's a great way to start doing that by doing an elimination diet.
Definitely. Definitely.
So, Dr. O, let me ask you this. What role does the immune system play with all of this, right? Because, you hear that some people don't even know that they've ever been exposed or they have light symptoms. And then some people are getting literally slammed with this. Like
Correct.
they're getting it and it's killing them or you know, they're
It's
being
severely,
hospitalized.
yeah, exactly. Exactly. You know, everybody's different, right? What affects me at a 10 might affect you at a 2, right? Everyone everyone has different tolerances, and I don't know if science has fully been able to understand why it might feel different or affect someone different compared to another person. But I will tell you, as far as what's going on right now with the immune system, a lot of people are forgetting that, this immune system that they have, it's a pretty good system, a pretty good system. If when we talk about the immune system, the goal of the immune system is to fight off any antigens that come into the body, right? And so antigens, they could be proteins. We're just talking about how proteins from milk cause inflammation. It could be sugars. We were just talking about G6PD deficiency. It could be bacterial cells, and in this case, virus, as we were talking about. Peptides is more about the proteins there. So as far as the immune system is concerned, its main goal is to make sure it seeks out any antigen that enters the system and takes it out, because it doesn't want anyone in the house that hasn't been invited. And so when we talk about antigens, the one that we're talking about in particular is the virus, right? Because that's the coronavirus, the COVID-19. And for those of us, I got a question from one of my patients who asked, well, what's the difference between coronavirus and COVID-19? Well, it's the same thing, right? COVID-19 is just the abbreviation of coronavirus. So the CO is for the corona, the VI is for virus, D is for disease. So coronavirus disease. And then the 19 is really just the year when the novel coronavirus was discovered, 2019. And so COVID-19, that's what it represents. It's just coronavirus 2019 shortened. And so when we talk about the COVID-19, we talk about viruses in general, viruses have very similar makeup. They come in different shapes, but with those shapes, they still have the main components, if you will. So what are those main components? We're talking about a protein coat. We're talking about the, if you follow the arrow here, so this is the protein coat here, protein coat over here. Over here, we're talking about the nucleic acids. And within those nucleic acids, you have your DNA and RNA. Those are the traits of the virus. That's what is then passed off when they go into the healthy cells. They then get these replicated and then turn those healthy cells into what the RNA and DNA codes are, and then they go off and start replicating, and this is how you become infected. And so there's also an envelope here, and this is the protection, right? Because the viruses have been around for millions of years. Viruses have been around longer than humans. And so they have been able to adapt as far as being able to survive in just about any environment on Earth. And so these viruses are very capable of being able to find a host, being able to get through its defenses, and being able to latch on and start replicating. Now, you can see the different shapes here. Now, when we talk about the COVID-19, it's more of a spherical shape, like what we saw in the previous slide. Now, we mentioned earlier the SARS-CoV-2 is the actual name of the virus that then leads to what is known as the coronavirus disease 2019. And so it's a spherical shape, and as we saw in the previous slide, it has the protein coat inside this covering, inside this protective covering here. And so what does that mean exactly? How does that affect our immune system? How does our immune system fight this? What happens? Now, we can get into a 4-hour lecture about it, but I'm not going to bore you guys with all the details. We're just going to broad stroke it here. So essentially, the way the immune system works is it is presented with an antigen. So right over here, if you see the mouse here, this is known as an APC, or an antigen presenting cell. And so what this antigen presenting cell does, it finds the antigen, which is right over here, it catches it. Now, there's several forms of APCs. One that's most familiar, known as a macrophage, part of the white blood cells here. And what it does is it basically envelops that antigen, but it takes a piece of it, and it takes that piece and presents it to our T cell. This T cell is essentially the antibody, because once it gets this antigen and it understands how it's made, it then forms what's known as antibodies. And these antibodies now look for this antigen. And so one of the examples I give is when we get stung by a bee. The first time we get stung by a bee, it hurts, but nothing really happens because it's the first time. So the body doesn't know what happened. It knows that there's a foreign object. It then takes a piece of this venom, if you will, and brings it over to the T cell, and now it forms the antibodies. Now, if you get stung again, the body is ready for it. And what happens, sometimes the body is too ready for it. And what will happen is you go into what's known as anaphylactic shock, because the body has essentially shut everything down to avoid this antigen from doing any further damage. And then you have to get the pen, the EpiPen, put it in the muscle there to kind of reverse that process. And so that's why when people get stung the first time, they don't know if they're allergic or not. They'll find out if they're allergic after the second sting. And so it's really important to understand that the immune system, it does this because it is trying to stop the antigen from causing any further damage. This is what inflammation does, right? This is the purpose of inflammation. This is also the purpose of fevers. We mentioned that with coronavirus, one of the symptoms is fever. Now, why is fever something that the immune system does? I mean, we see it not just with coronavirus, but when we get sick, we have the cold, we have the flu, we'll get a fever sometimes. Well, the reason why we have the fever, and we're gonna go back a couple of slides here. So we were talking about the protein coat. Now, when you apply heat to protein, it starts a process known as denaturing. Now, the best example of that is when you have an egg. When you first crack an egg open, you have the yolk, right? And it's liquid and it's fluid. As soon as you add it to a frying pan, it changes the entire physical component of that egg. It's still an egg, but now that you put it in a frying pan, you can't use it the way you would have used it had you left it alone. So for instance, usually you crack an egg, you can make a cake with it, or you can do it, put it in meatballs. Once you fry the egg, you can't do it because the molecular components have been rearranged. Same thing with fever. When the body goes into fever, it alters the makeup of the protein coat. By doing so, now that protein coat is unable to attach to the cells that it's supposed to attach to, thus making that virus ineffective. And so that's why we have fever. So fever isn't entirely a bad thing. It's when it becomes too high that we have to be concerned. Same thing with inflammation. Inflammation is not necessarily a bad thing. This is the body's way of trying to fight off whatever has entered the body. The issue comes in when the inflammation has now become too much, or when the fever has become too much. So one of the things that I try to tell my patients, when they have a low-grade fever, the first thing they do, they want to get the Tylenol or they want to get the Motrin because they want to fight this fever. I don't want you to think that fevers are bad. I'm not saying allow it to get to 103 and now you're passed out and have to go to the hospital, but allow the body to at least begin the process of trying to fight whatever infection is in the body. Now, obviously, again, I'm not telling people that if they have a fever that, well, Dr. O said that it's fine, I should just sit here and allow this fever to, no, obviously you want to monitor it. After it goes over, 100, 101, I would say we need to take definite action. In fact, you should be taking action even before it reaches there. One of the things that we do, we place a cool rag on the back of the neck, a cool rag on the forehead to just help keep the body cool. It's important that we are allowing, though, the body to fight whatever is going on naturally. Now, COVID-19 is kind of different, though, right? So with COVID-19, one of the things that's being done, they're trying to find a vaccine, right? That's all we're hearing nowadays. We have to find a vaccine. The vaccine is the only way we're going to be able to save people's lives. Now, I will say that this is a very serious virus, very serious virus. But one of the things that we've seen is a lot of people are recovering. In fact, there are far more recoveries from the coronavirus than there are deaths. And so I still think, though, it's important for people to understand what the vaccine essentially means when they talk about we need to find a vaccine. So when it comes to making the vaccine, they take, and this, let's say this is the coronavirus with the sphere here, they take this antigen, this pathogen, and they weaken it. And then once they weaken it, they mix it up with a few other things and then inject it into the body. Now, that body, once it has this pathogen, it goes straight to the T cells. Now, if you remember, we were talking about how you have the APCs, the antigen-presenting cells. By doing a vaccination, it bypasses all of that, which can be a problem. And I'm going to explain why. When we talk about natural immunity versus acquired immunity, right? So when we talk about acquired immunity, which is the vaccinations, is there a lifetime immunity? No, there isn't a lifetime immunity. It's going to run out eventually because it wasn't done naturally, as opposed to a natural immunity where you're always going to be immune from whatever it is that the body was able to build immunity to. As far as side effects, there are no side effects with natural immunity. However, you can have side effects with acquired immunity. And so, I think it's important that people understand the differences between the two. Now, the other thing, too, when we talk about immunity and making sure our children have it, immunity is passed from mother to baby when it's done naturally. If a mother receives a vaccine, she cannot pass that immunity onto her child. So it's very important that we're aware of that as well. And so as far as the immune system is concerned, that's a basic overplay of how the immune system works and why COVID-19 is playing kind of a pretty big role right now. The immune system is still trying to figure out what's going on. We mentioned earlier about inflammation. When that COVID-19 goes into the linings, the mucous linings of the nose, of the mouth, down into the trachea and into the lungs, the body reacts. The same way it reacts with fever, it also reacts with inflammation. The reason why the inflammation is a problem is because that inflammation leads to swelling and can eventually close off the airway, which then leads to intubation and ventilators. That's why you're hearing this cry for ventilators. Everyone, Governor Cuomo, Governor Murphy here in New Jersey, they're all talking about we need ventilators, we need to get ventilators. The concern is when the immune system does start working, it's going to close off the airway. Now, it's not something that happens to everybody, and I want to make sure I'm clear about that. You know, COVID-19 in most people seems to have a mild effect, but for those who have a severe case, when we talk about people being taken into the ICU, many times it's because the airway passages are now closed off due to the inflammation, and the patients need to be intubated, which is essentially a breathing tube that's placed down the throat, and then the ventilator breathes for them until the swelling eventually goes down in the airway. And so that's why they're telling you to wear the masks, and that's why they're telling you to wear the gloves to avoid taking any of the droplets and putting it into the mucosal membrane of your nose or mouth, and B, preventing you from having that inflammation process take place. So there's a lot going on. And I think it's important that we understand the immune system, we understand the difference between natural immunity and acquired immunity, and how this plays a role. And the importance also, too, of building your immune system, right? We want to make sure the immune system is at optimum level. You know, vitamin D, getting sun, eating salmon, which I would say, you know, any type of fish is vitamin D, but you don't want to eat too much. You know, mercury is one of the other concerns that we have. Vitamin A, the type of foods that come with vitamin A. And we also want to look at zinc. Zinc is a great way to help build up the immune system as well. So I apologize. I know I probably got a little wordy with it. I hope it wasn't too much.
No, not at all.
Yeah, no, this is great. I mean, quite a few light bulbs went off in my head, because it sounds to me like our knee-jerk response, and I guess it's just culturally, we've been trained that fevers are bad. So we automatically, if we run a fever, it's like, oh my God, you know, grab the Tylenol or, you know, whatever. You're right, to reduce that fever, as if the fever is the problem. And really the fever is actually trying to help you.
Correct.
Right? And then the inflammation, what I'm finding interesting is that it's not just about immune strength. It's also about immune balance, right? So that it knows when to shut off the fever, when to shut off the inflammation so it doesn't choke you to death or shut down your organs. And you hear a lot of that now, that people aren't, like they use the words cytokine storm, right? That people's immune systems are actually, it's not the virus that's killing them, it's actually the immune response
that's
to the virus. And so I find that very interesting. Like, what would make somebody's immune system, some people's immune system, over respond to a virus or anything else for that matter?
That's a great question. So you kind of hit it on the head earlier when you use the word balance, when we talk about homeostasis, right? So when our body is balanced, we're talking about the pH in the body. We're talking about the natural foods that we're eating, as far as making sure our blood is balanced. We want to make sure the body is balanced. And when there's an imbalance, you have dysfunction. And this dysfunction leads, as a chiropractor, normally when we talk about dysfunction, we're talking about structurally dysfunction, but there's also dysfunction in homeostasis as well, which then affects what's happening internally as well. And so one of the issues that we see are people who have either had health issues, whether it's diabetes, whether it's high blood pressure, and interestingly enough, people who are on prescribed medication. And so I would like to know, of the people who have unfortunately succumbed to this, how many of them were on prescribed medication?
Yeah.
Because I feel like that also plays a role as far as the immune response to this. And so when you, and you know, the body is very interesting. When your immune system is being tampered with, if you will, whether it's from not eating right or from introducing an outside agent, what happens is that it throws everything off. And so it's hard for that immune system to now act accordingly when you want it to, when all these years you've been doing things that have thrown off the immune system's ability to function correctly, to function in a balanced state, balanced manner. So to answer the question, why is it that the immune system seems to overreact in certain people and not others? I would say part of that answer would be the fact that there's an imbalance due to, in part, the diet that we have, as well as the over-medication that's been taking place in this country for many, many years now.
Right. Because I've heard, and I don't understand the science of it at this point. I haven't had a chance to really dig into it, but I heard something about ACE inhibitors, right? Sheila, you heard that? Or,
Yes,
you
I
heard
was
that where,
told to check my hypertension medication
Mhm.
by my functional medicine doctor to make sure that I was not on an ACE inhibitor, that it was a beta blocker instead, because the ACE inhibitors are actually having an adverse effect on anyone who contracts SARS-2 or COVID-19. And I don't think there's enough talk. There's been um, enough explanation to the general public about that issue. Everyone that I know quite a few people who have um, contracted SARS-2, COVID-19.
Mhm.
I already know 3 who are dead from it.
So,
And every last one of them had hypertension, heart disease, diabetes.
mm,
So what are we missing here? All those drugs having while they're repairing one thing or helping to maintain, because they're not repairing,
Mhm.
the adverse effect of those drugs be lowering the immune system so much until it does not have a fighting chance when something as serious as this particular virus hits that person?
half of
That's
the
the question that I have.
half of the Black population here in the United States has high blood pressure.
correct.
So that's a lot of people that could be on ACE inhibitors. And I
Correct.
wonder how many of them know that this could be putting them at higher risk. And is the medical system even dealing with that at this point? You
Well,
know,
they know enough to say that these are people, they've already stated that the majority of the people have hypertension, heart disease, diabetes. I mean, they've already said that. And so they know something, but we're not privy to all of the information that they know so that it can be shared with our community so that they can know what to do. I was told to stay off of aspirin because I have all of these health issues. And inflammation is a huge problem if you have autoimmunity. I was told to stay off of aspirin, ibuprofen, no ACE inhibitors to make sure that I am safe within my own right of not contracting this particular illness, or if I do, it won't be as detrimental.
Correct, correct. And it's interesting, we talk about the manufacturers who, are in charge of making these medications. And I don't want this to turn into a thing against big pharma, but one of the concerns that we have now is a lot of these manufacturers who are involved. In fact, I heard that Johnson and Johnson just acquired the rights to the vaccine for COVID-19. Same Johnson and Johnson who just earlier paid several $billions for knowingly putting our carcinogens in their powders. So, the
baby powder.
concerns, baby powder at that, exactly. And so, the concerns that we have now is we understand how the body works with as far as immunity is. We understand the effects of COVID-19. We understand why it's so dangerous because of the fact that it attacks the respiratory system more than anything else. We've seen how to combat the respiratory system as far as, the exercises, the ability to cough out the mucus. And we understand that in majority of the cases, people who acquire this unfortunate virus, many of them will recover. So now the question is, as far as the immunity is concerned, as far as now this vaccine is concerned, are we now walking down or sliding down a slippery slope where, because of everything going on, people are going to now say, well, we have to have something that will keep us immune from this moving forward. And, my concern is, what's good for the goose isn't necessarily good for the gander. There might be some people where the vaccine is absolutely what they need. But I don't know if it's something that we should make mandatory or to put as something that everyone must take. Just talking about medications that we're on now. And the effects that they have. I look at Zantac. Zantac was a very popular medication that everyone took. You had a problem, a heartburn, take a Zantac. And now Zantac has been recalled because it causes cancer. And so these are the things that concern not just me, but I think also the Black community, a community that has been, unfortunately, at the short end of the stick when it comes to the U.S. government and when it comes to its inability to properly take care of people of African-American descent, we think about the Tuskegee experiments, we think about, all of the different eras where the United States government has failed the Black community over and over again. And so the concern that I have is not just the fact that a lot of African Americans not only suffer from diabetes, suffer from high blood pressure, but now they also have these ACE inhibitors, and they also have this doubt because of the history of this country with the African American community. And then you add the emotional stress of not being able to go to work because everything is shut down right now. Where are we going to get money for rent? Where are we going to get money for food? These kids are home because they're not going to school. How are we going to help them? Because we don't have all the laptops necessary that some other families have. And so you combine all of this. And it's no wonder that the African American community is suffering far more from this. It's not so much that the virus is affecting us more than anyone else. It's just our inability to be able to respond effectively to it because we've already been set back well before this virus ever appeared.
Right. So
and this is something that's also important, Dr. O. This crosses all socioeconomic statuses in the Black community because I was put on losartan. I was on that particular ACE inhibitor for 7 years.
Wow.
October 2018, when I found out I had breast cancer, that very month, the FDA said losartan is causing cancer. I mean, that very month is causing cancer. Now, this is a drug that they said was safe and approved. And then there are other drugs when you have to read all of the ingredients, because if you do have G6PD deficiency, you can't have blue dye. That is very dangerous to someone with G6PD deficiency. I cannot begin to tell you how many prescription drugs have blue dye in them. And we don't know these things unless you're able to read the inserts. You have to read the inert ingredients to know, because a minuscule amount built up over time can cause damage to the body. So when we're talking about something like COVID-19, here we have bodies that have eaten well, done the things that they could do right. They could be suffering with hypertension or some other type of condition, autoimmune disease, and they've been on medications that have gradually taken the body down little by little by little until instead of the immune system here is here.
Correct.
So this is a perfect storm then.
Yes.
Right? Like all the conditions that just culminated now to the point where you know, we are dying at the highest numbers with this outbreak. And one of the things that I noticed too is that everybody that I know that have been hospitalized so far have tried to go to the emergency room having trouble breathing several times.
Hmm.
They and were turned away with no treatment. So by the time they're accepted into the emergency room, they're passing out, almost dead. I mean, you know, I find this troubling because, if there were no outbreak, let's say this was last year this time, and you went to the emergency room presenting with an inability to breathe or having trouble breathing or some type of respiratory distress, would they send you home with no treatment?
Doubt it.
So how many people are dying not from COVID, but from the protocol, right? Because whether or not they treat you or take you in depends on a protocol. They'll say, well, you have to have 4 out of 6 of the symptoms. Your fever has to be over a certain amount. Doctors aren't really making those decisions anymore. They have to follow these protocols. So if the protocol is set in a way that's killing us, does anybody care to change the protocol to say, wait a minute, these people are dying? Maybe there's something wrong with the protocol since we're not allowing doctors to make that decision. Because really the doctor, like if you see your patient, you should be able to look at your patient and say, this patient is bad off. Their fever might be 100, but this person needs to be in the hospital, even if it's not 101. You know what I mean?
Yep.
So I have these questions. I can't help but to wonder how much damage the protocol itself that they have in place now during this outbreak is harming us.
Yeah, I heard there was a doctor, I believe it was out of New York City, and I haven't had a chance to watch the video yet, but I do want to do that. But apparently, he left his position because he felt that the protocol that they have in place was actually harming. And this is just across the board, all patients. Right now, they're treating it as if it's more of a pneumonia type of disease, but he thinks that it mimics more of a high altitude type of sickness. And so he feels that the protocol that's in place right now is actually negatively affecting the patients as far as the settings for the ventilator and the intubation. And so again, I just heard about it today, so I definitely want to do some more digging and research into that. But that's somebody on the front lines who's witnessing this. This is not me saying it. This is somebody who's there, who's saying it. So again, when we talk about protocols, they're still trying to, at least they're telling us, they're still trying to figure out what this virus is, and so the concern is they're going to make mistakes. Just hope it's not. These mistakes aren't made at the cost of lives.
Well, since you mentioned that, Dr. O, that goes back to standard care of treatment. Standard care of treatment does not work for everyone. It must be personalized.
Correct.
And here they are with a standard care of treatment for a condition and a virus that they're not even familiar enough with.
Correct.
And this could be why we're seeing the high rates of deaths within our community.
I agree.
Great. So I think this was a great discussion today. And I think we really should continue this.
I do too.
Let's make this a part 1 and let's come back and go and talk about this a little bit more, because our people are dying.
I agree.
And I really want to dig a little bit deeper into the G6 PD deficiency and
look at the medications, right? The medication that they're
autoimmune issues. I would love to get into that.
Yeah,
right.
To get into that, because there's not a Black person. There are only a few I know of that are not suffering from some type of autoimmune condition.
Mm-hmm.
Right. So we're gonna stop now. We're gonna come to a close for today. But if you like this, please subscribe to our channel and put it in the comments section. Ask questions. We're going to come back. If you have any questions for Dr. O that you would like them to answer, put it in the comment section and we'll be back with part 2.
Wonderful.